The Feast of the Epiphany, one of the holiest days of the Ethiopian calendar. Priests and deacons lead prayers around a tent that contains replicas of the Ark of the Covenant, brought from churches around Addis Ababa. The festivities go on all night as families gather to pray, dance and sing. The next morning, more people gather to listen to the religious leaders and join in the prayers. Many undergo a symbolic re-baptism using fire hoses. Later, people crowd the city streets as a procession escorts the holy arks back to their churches. Ethiopia is rich in religious traditions, but tradition extends beyond religious practice into social practice, in particular the treatment of women in society. Historically, women in Ethiopia have been of low status, seen as not deserving of education and denied opportunities to direct their own lives or participate in community and national development. In rural areas where 85% of the population live, it was not uncommon for girls to be married in their teens and to give birth to many children, which the family then struggled to feed and educate. Although the country is now experiencing rapid economic growth of over 10% a year, women still lag behind men in all fields of advancement. Fortunately, the government recognizes the importance of women to the future health of the nation and has made efforts to improve their lives. The implementation of family planning and reproductive health programs is one example. At government-run health centers like this one in Addis, women can come to obtain contraceptive counseling and services, safe abortions, and even to give birth. All services are free to patients. Although basic, the health center's equipment and staff have helped save the lives of women and babies who otherwise might have died due to complications in labor. While improving, Ethiopia still has one of the highest rates of maternal death in the world. This is partly due to the traditional preference for giving birth at home with no skilled help. Outside the cities, things get even harder. EngenderHealth CEO Pam Barnes explains one of the biggest challenges in Ethiopia.
Simply getting access to healthcare, even at a community health center, may mean walking 8 to 10 kilometers or more to get that healthcare.
To cope with a critical shortage of medical professionals in rural areas, the country set up a system of health extension workers. They're usually high school graduates from rural communities who undergo a year of training from EngenderHealth, then return to their village equipped to deliver a package of preventive and basic curative services. It's a heavy workload. One health extension worker serves about 2,500 people, but it's a well-paid and well-respected job. Every 2 weeks, the health extension worker in this village meets with the village women over coffee and fresh bread. For 40 minutes, women tell their stories, ask questions, and even role-play what advice they would give a neighbour who wants to know more about family planning. This kind of grassroots outreach has made a big difference in awareness and usage of family planning. Couples are able to learn about different methods of contraception and see the benefit of choosing the number and spacing of children they want to have. This is the Dobre Berhan Hospital, a rural facility in Amhara, about 2 hours' drive from Addis. It serves 2.5 million people from surrounding communities. Dr. Fiseha Tedese works tirelessly. He's the hospital's director as well as its only obstetrician. Over the past 16 years, he's seen maternal health and services improve, with a lowering of the maternal death rate, more midwives and surgeons, more women delivering in hospitals rather than at home, and the rollout of family planning services. But there's still more to be done. Training is crucial, and the hospital is fortunate to have a dedicated training centre set up with the help of EngenderHealth and other sponsors.
This training center is very important for us. One thing, it's an income for the hospital. We get a lot of money from this training center. The other is our staffs are involved in the training. So we have a lot of expertise here in different professionals are here, internists, surgeons, gynecologists, and midwiferys. So they are participating in giving training for the other staffs from the rural areas.
Hospitals like this are key to improving the health of rural communities, but they also face problems like staff shortages and long waits for equipment. So what about the future? While Ethiopia is modernizing, old ways take time to change. This school in Amhara serves 9th and 10th graders. We attended a meeting of the school's Gender and Health Club. This 15-year-old told us the story of how her parents wanted to marry her off at the age of 12. She refused and ran away from home. She no longer has contact with her family and supports herself by doing laundry and cleaning jobs and selling injera, the local bread. Her classmate also left her village to attend school here. Back home, she was the victim of sexual harassment and abuse. Although the school is poor and lacks good facilities, she hopes to graduate and go to university. These young people are Ethiopia's future. Hopefully, with a mix of the right policies and investment in education and health, that future will be a better one. For EngenderHealth, the ultimate goal is to get the country to a level where it can run programs on its own.
And when we know that more women's lives are being saved, and they can be saved through family planning and other reproductive health services, when we see that, we will know that it's time for EngenderHealth to step back and to congratulate our Ethiopian colleagues and say it's a job well done.
While that time is not yet here, Ethiopia is making progress every year. And that is something to celebrate.